Thank you, Scott. And it's really nice to be here. I feel very comfortable being with a bunch of doctors. In a time of tremendous advances in scientific research and medical technology, I commend the work of the Miller-Coulson Academy of Clinical Excellence. Their mission to recognize those who excel in patient care and their endeavors to promote, advance, and encourage excellent patient care is impressive and much needed. I also want to congratulate the recipients of the award. As I read over the criteria, I realized how extensive they are. Not only are you an expert in your field, but you have a passion for patient care and relate well to your patients, and you mentor and inspire medical trainees. You are a complete package, one of value and by your patients and of this institution. I was asked to speak to you as a patient in a medical physician's family. Medicine has been a part of my entire life. I'm a granddaughter and daughter of physicians. My husband was a Hopkins doctor, and so are our two sons. One daughter-in-law is an internist. I must admit that I love the profession, but my experience is of the homegrown armchair variety. My husband Lee used to say that one good reason to go to medical school was that when you got sick, you know who to call. Knowing a good doctor's doctor is indeed one of the perks most of us in this room possess. I asked my family what traits they looked for in making such a choice. Some things they said were expertise in his or her field, a proven track record, trust, character, one who relates well to patients, persistence, integrity, and judgment. I'm sure you can add a lot more. I've been fortunate to have had doctors all my life. I've been confident in their skill and their knowledge, and they in turn have been compassionate and have been taken interest in me as a person. And I could sense that for them, medicine was a calling and not just a job. Trained at Hopkins, my husband was part of the full-time staff, and he was a pioneer in total joint replacement. He was one of 10 given permission by the FDA to perform the first total hip replacements in the United States, and 1 in 5 to design the first total knee prosthesis developed and used in the US. It was an exciting and challenging time for him, and he was in demand to teach techniques here and elsewhere. As a family, we saw us teaching videos, handled prosthesis, and even mixed up some bone glue to fix the shelf on the refrigerator door. That shelf outlived the motor and must still be intact in a landfill somewhere. 6 months after my husband died, I needed 2 long postponed total knee replacements. They were some of the fruits of his labors. Perhaps you have heard the definition of major and minor surgery. It is minor when it's done to someone else, and it's major when it's done to you. This was my major surgery. Thanks to Carl Johnson, who is a meticulous surgeon and a kind and compassionate friend, I had fantastic results. I've been heard to say, I love my knees. Carl never took it for granted that I would or should know what to expect. His willingness to brief me about the surgeries and to guide me through the surgical recoveries made me feel a part of the process. And I was able to push through the early discomfort of physical therapy to achieve swift and excellent results. Now at checkups, when we look at the x-rays and Carl says, perfect fit, 9 years out, no wear, we both are happy. And I feel as though we're viewing a Michelangelo. As I conclude, I think the advice that my husband gave our sons when they were contemplating medical school speaks to some of the talents and dedication exemplified by those of you who are honored today. It was at a time when some doctors were disillusioned by the profession and they feared for the future. Some were advising their children to avoid the profession, to consider something else, anything else but medicine. Our boys had vicariously experienced their father's hard work, as well as the fun, a word he used a lot to describe the joy he found in patient care. Most importantly, he was a great father, taking time to be a part of their lives. He told them that indeed medicine was changing, but there would always be patients who needed them, and that they, the patients, were the reason to practice. He advised them to be passionate about whatever they did, to never stop learning, and to work with people in whom they could be proud. It was wise advice, and I feel as honorees of this Miller-Coulson Award, you have found your way to achieve those goals. To the honorees, speaking as a wife and mother, I hope you allow yourself some time to become refreshed and recharged with your family and in doing other things you love. And on behalf of your fortunate and grateful patients, I thank you for your care and extend heartfelt congratulations.